Stop saying you have autism because you probably don't. Hi everyone, Dr. Leonardo Batista here. Today I want to talk about something that's been all over the news again. The idea that we're living through some sort of autism epidemic. Recently, even national leaders have suggested links between autism and medications like Tylenol, fueling new waves of anxiety for parents and patients. But as a psychiatrist and experienced medical director, I want to bring perspective. What we are seeing is not an epidemic of autism. It's an epidemic of diagnosis, or misdiagnosis, if you will. Because over the past 2 decades, the criteria of autism have expanded so broadly that traits once seen as part of normal personality, or personality traits, or even personality disorders like shyness or too much rigidity or social awkwardness are now often labeled as on the spectrum. This shift did not happen by accident. I'm afraid it reflects a broader cultural movement that equates difference with disorder and then celebrate the disorders itself as a new identity. While inclusion and compassion are vital for sure, we've blurred the line between supporting individuals and redefining human resilience. In the military, where I have experience, we teach something called MRT, Master Resilience Training. It's about facing adversity without collapsing into victimhood. Resilience isn't about denying suffering. Not at all. It's about building strength through it. And I believe that as a society, we've been moving in the opposite direction. When every discomfort becomes pathology and every unique behavior becomes a new diagnosis, we strip people of the opportunity to grow through challenge. We've been telling children that labels explain them instead of teaching them that effort transforms them. That doesn't build self-knowledge. It builds fragility. True mental health doesn't come from over-medicalizing human experiences. It comes from developing meaning, responsibility, and resilience. Not everyone who struggles socially is autistic. Not every emotional pain is a disorder. Sometimes it's just part of being human. And learning to adapt is where growth happens. I say this with compassion, not criticism. Those who live with genuine autism deserve the best care and understanding we can offer. But by overdiagnosing, society creates this diluted meaning of real conditions. It ends up overwhelming families with labels and risk raising generations who no longer see challenge as a call to act, but as a reason to stop trying, to give up. So before we talk about epidemics, please, I ask you, are we witnessing a rise in autism? Think about it. Or this is a decline in our tolerance for difference, frustration, and struggle. As clinicians, educators, and parents, our mission should be to help people become stronger, not just more diagnosed. I'm Dr. Leonardo Batista. Thank you for listening, and let's keep this conversation grounded in science, common sense, and the courage to build resilience again.